Welcome to Nursing the Nation, the podcast where we dissect today's headlines, current events, and hot topics through the uniquely insightful lens of our nursing expertise. I'm Jamie Bourgeois, a midwife and psychiatric nurse practitioner.
And I'm Melissa Ann Dubois, an experienced perinatal nurse. We are both nursing PhD students, and together we use our nursing expertise to break through the jargon and political noise to explore the human element of current affairs, providing a grounded and compassionate understanding of the issues that impact us all.
Because when it comes to understanding the pulse of our society, who better to ask than the most trusted profession? Welcome to Nursing the Nation, the podcast where we dissect today's headlines, current events, and hot topics through the uniquely insightful lens of nursing. I'm Jamie Bourgeois. I'm a midwife and a psychiatric nurse practitioner.
And I'm Melissa Dubois. I'm an experienced perinatal nurse and nurse educator. We are both PhD students, and together we use our nursing expertise to break through the headlines to explore the human element of current affairs, providing a grounded and compassionate understanding of the issues that affect us all. Because when it comes to understanding the pulse of our society, who better to ask than the most trusted profession?
That's right. So let's start the show, Melissa. I'm so glad that you are on board for co-hosting this podcast. Back when we were in our health policy class, we were talking about how nurses are really not great at bringing our voices to the public and being able to share what nurses do, what is important about what we do, as well as, being like stakeholders in so many different aspects of life, even outside of the hospital. So that is where kind of this Nursing the Nation podcast was born. And I felt like, getting to know you over the last year in our nursing PhD program,
Mm-hmm.
there was nobody better who could have these discussions with. So, that being said, what are our listeners going to hear on Nursing the Nation?
Great question, Jamie. Nursing the Nation is not just another podcast about medicine, health, or wellness
Yes,
topics. We want to be clear about that.
very.
Instead, Nursing the Nation is a podcast about applying a nursing lens to the broader current events that shape our world. Together, Jamie and I will dive into today's headlines and hot topics, but not just specific health issues, but also things like economic issues, political debates, social justice movements, environmental concerns. Because we want to reveal how these seemingly unrelated issues fundamentally impact human well being, community health, and the very fabric of our society. Because ignoring current events is like ignoring the
Mm,
air we breathe, okay? It's
yes.
constantly impacting us, whether we acknowledge it or not.
Yep.
Being informed on today's issues empowers you to advocate for yourself, your family, and your community. However, staying informed on current events often comes at a cost to our sanity
Including
and mental
ours.
health, right? And the
Yes.
news is often overwhelming, political pundits are too political, and social media is plagued with propaganda and divisiveness. And we totally get that. And so that's where we come in.
Yeah. So as nurses, we are experts in breaking down complex ideas or what have you, and giving everyday people the tools and knowledge they need to make informed decisions. And people overwhelmingly trust nurses because of our frontline experience to everyday life. While doctors diagnose and treat, I should say physicians,
True.
and administrators manage the systems we work in which, for instance, you receive your health care.
Mhm.
Nurses are right at the bedside. They are also in your homes. We are within your communities. We are witnessing the direct human impact of current events, of health policies, and new laws every single day.
Mhm.
The intimate understanding of the role of every healthcare professional, as well as the patient experience and the practical realities of everyday life. This gives us, nurses,
Mhm.
a very grounded, holistic, and often more compassionate perspective on what truly works and what doesn't when it comes to our nation. So while we are not just experts in disease or health, we're experts in the human experience and that human experience within a complex system.
Exactly.
So, Melissa Ann, I did some math,
Oh gosh.
and believe it or not, I can do that a little bit. Just a little though. And together we have 50 years of nursing experience between the two of us.
Wow. Now you're making me feel old, Jamie.
Yes, yes. Well, I need to drag someone down with me. So I'm the one that carries the majority of that in the two. So and so anyway, my background in nursing has been like an amalgam of sorts, mostly in women's health, nurse midwifery, a tiny bit of skilled nursing facility, and urgent care. And now I currently practice as a psychiatric nurse practitioner in a community mental health center.
Excellent. And, in nursing school, I worked on an orthopedic medical surgical floor. And then when I graduated nursing school in my early 20s, I worked as a med surg float pool nurse for a year. And then I landed my dream job in maternal child health, where I have been a perinatal nurse for almost 2 decades in almost every level of healthcare: inpatient, outpatient, community, clinic, you name it. And for the past 3 years, I've also been pursuing my PhD in nursing, which is where I met Jamie, of course. And I hope to take a position as a nursing professor and nurse researcher after I defend my dissertation, hopefully next year, but we'll see, right?
I have faith in you. I do.
So that being said, Jamie, what sort of topics will be will be
Mhm.
will we be tackling, whoa, on the podcast?
Yeah, it's they can be heavy. So not all of them, but we're starting off debuting a five-part series, which is going to break down each tenet of the Make Our Children Healthy Again. This is a report that was released in May of 2025 by the White House as I think it was commissioned by an executive order.
Hmm.
And uh, um, So, whether or not you have children in your life, the actions proposed within this Make Our Children Healthy Again, which is part of like the bigger umbrella of Make America Healthy Again, or
Hmm.
MAHA, this movement, which will affect us all. So again, whether you have kids or not, this is something that's going to affect all of us. And this will be a series that you don't want to miss. And from there, as as they say, the world is our oyster.
Yes.
So we'll be covering topics from mental health, medical research, climate change, reproductive health, artificial intelligence. There's really no shortage of current events that affect everyday Americans. Another one I can bring up right now is civil disobedience.
Hmm.
We tape this just after No King's Day, and yeah, I can't wait to get started. So, Melissa Ann, how can our listeners keep up with us?
Great question, Jamie. You can find us on Facebook at Nursing the Nation Podcast, on Instagram at nursing.the.nation, and via email at nursing.nation.voice@gmail.
A lot of dots. Um, where there isn't dots is our Substack. So if you have a Substack account, you can find us over there at Nursing the Nation. This is where we will be posting our show notes, our references, and of course, don't forget to subscribe to us on your favorite podcast app so you can always keep up to date with a nurse's take on the nation. So, yeah, thanks again for tuning in to Nursing the Nation. I'm Jamie Bourgeois.
And I'm Melissa Andubois.
Thanks for joining us on Nursing the Nation, where we discuss the headlines and current events through a nursing perspective. Remember to follow us on your favorite podcast app, leave us a review, and share this episode with someone who needs a nurse's take on the nation. Nursing the Nation is hosted by Jamie Bourgeois and Melissa Ann Dubois. Topic research is done by Jamie and Melissa. Editing is done by Jamie. Music is by Magnus Moon. Head over to our Substack at Nursing the Nation for detailed show notes. We speak from the experiences and expertise of being nurses, but the opinions on this podcast are our own and not representative of any employer, institution, or organization we may be affiliated with. Thanks for listening, and please follow our socials.